Joining me now are Denise Troutman and Amanda Hoopt. Denise is the president and CEO of the Center for Women and Families, and if the name sounds familiar, yes, we are married. Amanda is a community health educator and trainer at the center. Amanda specializes in primary prevention education and partnerships to end domestic and sexual violence before they begin. Denise and Amanda, welcome to Health Matters.
It's great to be here.
Denise, let's start with you. I've heard a lot about the center. The center's name is getting around the community. Exactly what is the Center for Women and Families, and tell me a little bit about your mission.
The mission of the Center for Women and Families is the elimination of domestic violence, sexual violence, and economic hardship. So we really focus on those three areas in the community.
Can you tell me more about domestic violence? I mean, I'm sure that there are many people out there watching who don't know what it is or if it's a problem in this community.
Domestic violence is a huge problem. 1 in 3 women will be victims of domestic violence. I know you've heard those numbers before, and those are usually the first things out of my mouth when I talk about domestic violence. But Amanda's our community educator, and she speaks about this all the time.
Well, Amanda, then why don't you, jump in and tell us, tell our viewers, what exactly we're talking about when we talk about domestic violence. Give us a little bit of sense of how much of an issue this is in our community.
Absolutely. It's a very prevalent issue in our community, and domestic violence is one of those things where community members have a lot of associations about it, but it's really a pattern of abusive behaviors used by one person in an interpersonal relationship, a romantic relationship, to gain and maintain power and control over the other person in that situation. So we see lots of different forms of abuses when we deal with clients that enter the center's doors. Everything from physical abuse, which is a very common sort of association that most community members have about domestic violence, to economic abuse, one person sort of controlling money and finances. We also see emotional abuse, things like verbal insults, kind of minimizing abusive behavior, acting like it wasn't as severe as maybe it was. A whole gamut of things from sexual abuse and then on to other abusive behaviors.
I want to ask you about this as a public health issue, which we've talked about, but before I do that, there may very well be someone watching the show who something you said may have sparked a thought in them. They may not have seen what's going on in their lives as domestic violence. What kind of things would you ask people to look for to begin to see if this is something that may be a part of a dynamic in their life?
Absolutely. I'm really glad that you asked that question. Those red flags are really key things in terms of recognizing and then doing something about abuse. One of the earliest red flags that I see forming in a lot of relationships is jealousy. One person really acting jealous, having a desire to kind of control where a person's going, who they're interacting with, their sort of association socially outside of maybe that relationship. So jealousy is a really big factor. And indeed, all those things linking to that about power and control. One person who seems to want to have more power and influence in that relationship than another person. Other things that I often bring up in the community is a big warning sign is if a partner is trying to deny access to money or to finances or resources in that relationship. If a person feels really cut off from some of that stuff, that's another indicator. And then again, all of those other things. Physical violence is obviously a key indicator. Anything from hits, threats to hit and shove, things like that. And then, emotionally abusive things like verbal abuse, calling somebody names.
And know that our clients come from the West End, they come from Highlands, Anchorage, Prospect. I think there are some people that think that there is no way that we touch as many lives as we do throughout the community. So it's important for folks to know that. Also, too, as Amanda talks about these different abusive areas, we also go into elementary schools and middle schools and talk about healthy relationships and talk about bullying and talk about teen dating violence. These are all things that sort of lead into the whole issue of domestic violence that the center's on the forefront of in the Kentuckiana and Indiana area. We actually serve 7 counties on the Kentucky side. I think people are not aware of that. We also serve 7 counties on the Indiana side with education, with awareness, with legal advocacy, with hospital advocacy. So I always tell people that we're more than a shelter because there's just so much going on at the center.
And you both touched on a couple of really critical issues there. I mean, you sometimes hear people say that, well, this is domestic violence couldn't happen in my community. This is only that community. I know you often say that it's, I think you have it's from Anchorage to, I forgot what it is you say often, but they indicate that it can be anybody.
Absolutely.
It doesn't limit itself to any socioeconomic strata, any racial group, any ethnic group, everybody is affected by it.
We actually have 3 centers that service this entire area. So we have got our downtown location that has a total of 80 beds. We've got a Southern Indiana location that has a total of 30 beds, and we have a West Louisville location that has a total of 30 beds as well. So we have a pretty broad area.
So why are we talking about this on a public health show? What's the connection here?
I'm really glad that you asked. I get that question occasionally when I'm talking to healthcare providers. I think that it's important to recognize a lot of studies have shown that more than a third of women seeking care in hospital emergency rooms for violence-related issues have been injured by a spouse, boyfriend, girlfriend, or former spouse, boyfriend, or girlfriend. In addition to the injuries that are received that they're seeking care for, a lot of times physical and psychological abuse is linked to various other adverse health effects. Mm-hmm. So we see things like headaches, chronic back and neck pain, all sorts of different sort of health effects, everything from chronic pelvic pain, sexually transmitted infections, to stomach ulcers that are directly related to the effects of domestic violence and trauma, things like that. So that's a huge thing. In addition to that, a lot of times people in the community are really shocked to know that 1 in 4 women seeking prenatal care have experienced domestic violence. In fact, it's much more common for people coming in to prenatal appointments to have experienced domestic abuse than it is for preeclampsia or gestational diabetes, which are conditions that pregnant women are routinely screened for. Beyond that, too, we know that the impact on kids is extraordinary and enduring, so that kids who have been exposed to violence also experience and suffer from symptoms of post-traumatic stress disorder, things like bedwetting, nightmares. Also, they're much more prone to experiencing symptoms, things like asthma, breathing kind of problems, gastrointestinal problems, headaches, even the stomach flu, more than their peers who have not been exposed to violence.
So would you say, either one of you, would you say that domestic violence is in epidemic proportions in our community?
Absolutely. When you think of 1 out of 3 women who will be victims of domestic violence, it absolutely is an epidemic. Also, to the tie to public health, I think you yourself have talked about upstream thinking.
Yes.
And upstream thinking is a huge part of the center because of our initiatives around prevention and getting out to youth and getting out to the faith community and all those things that public health also does. I always tell people that the first time I heard this, it was David Satcher who said the gap between what we know and what we do can be lethal. And many people don't look at domestic violence as something that kills and kills a lot. And so we are absolutely part of a very similar fight as the public health department is too. And education and awareness is a huge public health element.
And certainly one of the things that we talk about in public health is the value of community health education. Could you talk a little bit about community health education when it comes to this issue of domestic violence?
Absolutely. That's a huge part of what my job role is at the center. And so it's really all about that, about community health education, about reaching youth and individuals in the community before violence has ever occurred. So my focus as a prevention educator at the center is to sort of move beyond maybe a 75-minute awareness session where we're giving lots of great facts to do a longer-term educational program where the focus is about still disseminating some of that knowledge and information, but also about teaching skills for healthy relationship building, skills that teach students and young people how to change policies that impact sexual and domestic violence and things like that. So it's really about imparting healthy skills, encouraging healthy behaviors, and getting people really focused on good kind of personal health and relationship health.
Amanda, can you tell us about Health Cares About Domestic Violence Day?
Well, let me give her an entree into that. October is Domestic Violence Awareness Month,
Yes.
and we are so happy that the health department and the city has taken this issue on. And so we've got a series of things going on in October, with health cares being one of them.
Absolutely. Because domestic violence, as we were just kind of talking about, is such a critical health issue. We know, for example, that the estimated cost of domestic violence to our healthcare system is about $5.8 billion a year. So it's a huge thing. Health Cares About Domestic Violence Day is really an effort to reach into that community. So it's an annual nationally recognized awareness-raising event that's sponsored by the Family Violence Prevention Fund. And essentially what the center is asking people to do locally is we're encouraging residents to contact their primary care provider on the second Wednesday in October, that's Wednesday, October the 8th, and to just thank them for screening for domestic violence, or if that didn't happen in the last appointment where they were seen by their doctor, to encourage them to begin screening for domestic violence. We know statistically that screening is a really important thing for healthcare providers to do. A recent study kind of revealed that people are more likely to disclose to a physician, a primary care provider, than they are to disclose to anybody else. And in the majority of domestic violence cases, people have disclosed to somebody before they ever seek services. So screening then becomes a really important way of doing this. So we've created a wonderful screening tool and a script for members of the community to use to talk to their healthcare providers about providing the screening.